Does alcohol cause cancer? Very, very important question, and the answer to that is hello and welcome to another weekly edition of the Vysana Newsletter. I'm Dr. Sunny Dhesi, and I'm here at our clinic, Vysana Life, which we are known as on social media, and I have some interesting things for you to share. Well, I hope they're interesting, so please keep watching. If you haven't subscribed to the YouTube channel yet, please do. The more subscribers, the better it makes me feel, and then obviously I'll be always sharing. But yeah, the comments and feedback we get are brilliant. I really appreciate it. And yes, subscribe to the YouTube channel, do follow us on Instagram, and we're also on Twitter and also TikTok as well. And in all cases, it's Vysana Life. Thank you. So, does alcohol cause cancer? Very, very important question. And the answer to that is yes, it is classed as a carcinogen. The WHO, the World Health Organization, do class it. And whatever misgivings you have about what the WHO, the political organization or not, alcohol is definitely classified as a carcinogen, and that's where the topic of my talk is going today, because we finished dry January. A lot of patients abstained, and abstinence is always good, and they've realised the benefits from that. They've realised weight loss, better cognitive function, so better brain function, more energy levels. And the question is about, well, why would I go back to drinking alcohol? Is there any benefit to it? It's mixed reviews. Sometimes you get these articles saying, 1 or 2 drinks a day is beneficial. Is it better for heart disease? Is it not? So these are all questions I wanted to address here. But one of the things I will share with you is that there's always a lot of worry about HRT. And I'm not saying that HRT, hormone replacement therapy, is the only treatment for menopause. Obviously, it is a very effective treatment for menopausal symptoms, I should say. I remember what we say in this video is advice. If you need a consultation, then please do consult with your healthcare practitioner or book in for a consultation. This is advice and education rather than for treatment and diagnosis. So HRT is very effective, and there's often a worry for many women that if I go on HRT, then there's a risk of developing breast cancer. Now, the risks are very small. The risks that we kind of traditionally remember are from a study that was done in the early 2000s, where results were basically misinterpreted and the study was stopped, and there was a huge headlines, HRT causes cancer and therefore women shouldn't be on it. And that's the medical field or medical sphere that I grew up in, where HRT was just a no, doctors are reluctant to prescribe it. And now things have changed, obviously, with advocates like Louise Newson and Davina McCall. And I think it's very important, especially, I believe that the global healthcare system is broken, it's failing women, and we can see evidence of that in just how much women's health initiatives there are. So with HRT, the risk is small, but what we don't often look at or read or advocate is that the risk for developing cancer for women is high if you're a drinker, if you drink alcohol. So it's a topic that gets you rethinking about the next drink that you pick up. We're talking about alcohol and your health, so I've been rabbiting on for a little bit. So, as I said, dry January has just happened. The World Health Organization dropped a bombshell on alcohol. I think this was last year, that there is no such thing as a safe drink. Even one glass of wine a day isn't off the hook. So before you go to your drinks cabinet and just pour everything down the drain, pause. Research published in The Lancet, which is an established and generally overall a good medical journal, that alcohol is toxic, it's addictive, and it is a group 1 carcinogen. Now, I know what you're thinking, but what about heart health? So benefits of, an evening glass of red, the Mediterranean diet. It turns out those benefits might be more about the healthy lifestyle of light drinkers rather than the alcohol itself. So it's really hard to differentiate between, is it the 1 drink a day of a glass of red wine, or is it to do with lifestyle? And it's hard to separate those two things out. And obviously, as research goes on, it's more increasingly about the lifestyle that those people lead rather than that glass itself. Research at the University of Oxford showed that alcohol doesn't do any favours for your brain function either. And those hoping that a little tipple would protect your heart. 2022 studies beg to differ, linking even light drinking to increased levels of hypertension and coronary artery disease as well. So where does this leave us, especially during those perimenopausal years when health becomes a tad more complicated, as we've discussed in the past? It seems that the message is clear. Less alcohol is definitely best. But don't worry, it's not all doom and gloom. Reducing your intake from, let's say, for example, 4 drinks to 2 can significantly give you health benefits. And for those of us who enjoy a little tipple, moderation and mindfulness is the key. And that's our mantra here. I'm here to guide you through a journey through mindfulness and medicine to get you through this menopause journey, which is now increasingly more of a lifelong journey. It's about managing symptoms. So remember, when you're considering a dry lifestyle or you're just curious about your health, it's always a good idea to chat with a healthcare professional. Have a consultation. I take that word back, chat. It's about having a consultation, having a discussion, looking at your concerns, looking at your ideas and expectations about what you're going to do. Now, thanks for joining me on these weekly video newsletters. And I just want to re-emphasize that these are educational videos. They're not designed to treat or diagnose. We've had a few comments asking for potential diagnosis and treatment. That's not what we can do really through social media. So I take this responsibility very, very deeply. I'm very passionate about it. I believe that there should be good access to knowledgeable medical care, but that has to be done with a healthcare professional. So these are about education. This is about telling about what's going on in clinic and really focusing on what's important to you through education, so that when you need advice, you can come in to clinic and see us, or you can seek help or advice from your healthcare practitioner. So thank you. So many of you had a lot of questions about this new sort of innovative service we're offering about skin analysis. And so I thought I'd share with you a little bit about how it works. So a patient of ours has kindly agreed to share her picture and the areas where the skin analysis works, like the areas that it shows where there's a problem. I think I showed you mine last week. And kind of on a weekly basis, just kind of share a little bit with you about the areas of concern, how those areas of concern match up with the scoring system, and then potentially products or treatments that can address those concerns if they're actually a bother. So yeah, please carry on watching, and I've done a little bit of voiceover and video, and hopefully that gives us more insight into our sort of skin intelligence service from Vysana. Here's an example of a picture that you may get from a skin analysis report. So here we have the results of the skin analysis, and if we go in a clockwise fashion from 12 o'clock position, we can see that it's given us quite a few scores. So the overall skin score is 73, so above 70 is pretty good. I would say it's kind of average for anyone coming into our clinic. And as we work our way around, we can see that some of the scores are in their 80s and some of the scores are lower. But I'd like to concentrate on, for example, dark circles, firmness, and droopy lower eyelids. And that would form the basis of how we would do a skincare recommendation, or maybe even a treatment recommendation. So, for example, for this person who's kindly shared the picture with us, what we would do is we'd probably recommend more focused skincare to work on the under eyes, so a retinol-based under eye serum, eye cream that's high in peptides and maybe resveratrol, and also improving the moisture content overall of the skin. If we go round the clock face, we get to moisture at 67. And what we want to do here is recommend skincare products that help to lock in moisture so the skin isn't as dehydrated, and also firming up the under eye skin as well, where it says IBAG 66. So this is just an example of how the skin analysis that I spoke about last week can be used by yourself or by us as well with our help to enhance your skincare. So a little bit of a party pooper this week. We're putting the downer on alcohol. I think it's really important to understand how different things can affect us, especially as we get older. What I would say is that we need to embrace knowledge. We need to embrace everything. As I said before, this is all about education. I'm here to help guide, so I always appreciate comments and feedbacks. But that's me for another newsletter this week. I'm Dr. Dhesi, and this is Vysana Life, and thank you for watching.